Well, hello, everybody. Welcome to the Healthy Joints Healthy Lifestyle Show. And I have a phenomenal guest for you, Dr. Teja Mehendale. And she is an amazing physician on the east side. If you're in the Bellevue area, this is the family's physician that you need to see. So she currently practices at the Medical Arts Associates in Bellevue. Actually, a stone's throw from me. You're my neighbor. You're not, you're just a stone's throw away. And she
That's true.
graduated from Windsor University. I'm so glad to have her here, and I haven't even begun to go into us all the accomplishments that she has. But I'm going to say that one of the things I love about Teja is that she's a strong advocate for our patients, and she's committed to providing comprehensive evidence-based care with dignity. So I'm going to let Dr. Mehendale tell us a little bit about herself. But don't forget, thank you for coming to the Healthy Joints Healthy Lifestyle Show. I'm Dr. Dada, for those who don't know me. Don't forget to like, subscribe, share this. This is going to be a phenomenal talk, and I'm excited to talk to Dr. Mehendale. So now I'm going to let her talk and tell us a little bit about herself and why she does what she does. Hi.
Hi, Dr. Dada. Thanks for having me on here. It's very nice to see you.
Nice to see you.
So, a little bit about me. I'm a family medicine physician and very proud of it. I chose family medicine because of the scope of family medicine.
Mm,
So, for those who are not aware, family medicine actually, we are trained to be the only doctor in a square footage of about 50 miles. So, we have to know a little bit about everything, right from delivering babies to doing minor procedures, maybe even a C-section, and all the way to even scopes, endoscopy, colonoscopies, those kind of things. So what we practice, what we're trained in is very broad, but what we decide to practice in is really up to us. So it's a very broad scope, and that's what I enjoy about medicine. And
I
that's why I
love
chose to
that.
be a family medicine doctor. Yeah.
I love that. I love that. So what drives your work today though? So kind of talked about what you love about, family medicine. What's motivated you, I think, is a little bit of what, I think is
Mhm.
what motivates you, what drives you. And it's so
Mhm.
interesting. The exact thing that drives you may, for some of us, like I was like, it's too broad. It's too broad. And I'm just watching how you're just relishing just the diversity of it all. And I'm like, give me a narrow home, please. I love that. I love
Absolutely.
that. How different things just so motivate us. But yeah, so
Motivate.
tell us,
Yeah.
yeah. So tell us what drives your work today.
So the original factor was science and the body. The body itself, we talk a lot about AI nowadays, and to be honest with you, Doc, we are the perfect machine that was created. Every the feedback mechanisms, the nuances, the stimuli, the external internal environments, and how they're maintained, the homeostasis. It's just phenomenal, and nobody can dream this up. Even it's amazing. Um, that itself was very fascinating to me to begin with, and that's why I chose science and biology and therefore medicine in general. But to be specific in terms of the scope, what I realized very early on was actually not just through my life, but just interacting with people and patients, is that not one system is independent. Everything is dependent on each other. So for me, it was a disservice to focus only on one aspect of medicine, because then I'm disregarding a lot of the other aspects that can actually make something worse or better or affect it in some way, right? So
Yeah.
for me, it was important to understand the entire person, whether it's from a psychological standpoint, whether it's from a physical standpoint, even a financial standpoint for that matter. And
Mm.
so that family medicine comes very close to that perspective, if
That
you look at
whole,
it that
yeah,
way.
looking at the whole, the body as
Mhm,
the, and the human being as a whole entity.
mhm,
I love
mhm,
that. So one of the things that I know you're an expert in is asthma.
mhm.
So
So,
can you tell us a little bit about, kind of common symptoms? How do you know
mhm.
you got it?
Absolutely. So asthma, somehow has been I've been very passionate about asthma, and I personally don't have asthma, but just the thought of somebody not being able to breathe, it just, just would always just
It's
drove me.
scary.
So
It's scary. Yeah, it's
it is
scary.
scary. It is very scary. It's very unnerving, very scary. Pain is one thing, but just not being able to breathe is just another. But anyway, so I really like to treat asthma, make sure my patients are aware that they have asthma. Common signs and symptoms really can vary. Most common is a cough, usually a dry cough, seen mostly in kids, but even adults. And it can be as subtle as a person has an upper respiratory tract infection, which then leads into a cough that just persists and never goes away, or that goes away after a very long time. So that's one. Cough is very common. Wheezing is a very like a musical sound, and it almost sounds like a kind of a sound. And patients don't always know that they're making it. Sometimes we have to auscultate, meaning listen to the lungs to be able to hear it. But at times we can even catch it just talking to the patient. There could be like a feeling of like chest tightness or pain. Patients can sometimes even just be tired. That's it. Like, doc, I just feel like I'm not drawing a full breath. I just feel tired. Shortness of breath, just feeling short of breath. But those are more dramatic instances where patients know something's off and they go to the ER. When I
Mm.
see them in the outpatient, it's a little more subtle presentation of asthma.
Yeah. So just for our audience, when you said auscultate, you're
Mhm.
referring to listening to the chest with a
Correct.
stethoscope, right? Yeah, front and
Correct.
back.
Yes.
And so, yeah, so you kind of said that, hey, these are the kind of more acute,
Hmm.
coughing, shortness of breath, kind of
Hmm.
wheezing. I love that description, musical. You really are an asthma specialist. The musical sound from the chest. Yeah, that's such an apt description. It's been a
uh,
long time since I thought about asthma. But
yeah.
yeah, yeah, that's really such an apt description. So you kind of talked about more acute settings, that's kind of
Mhm.
ER type presentation, and then you kind of hinted that there may be more subtle presentations.
Yes. So oftentimes I've cut asthma in, for example, a family member that comes with my patient. And just the way they speak, sometimes you can catch asthma. So there's a certain tightness, and maybe physicians can appreciate that. It's almost like that
Yeah,
they begin that or they end that with that
yeah,
kind of difficulty and bringing that word out. And it's not something that they even realize that they're doing. It's
yeah,
just because they're so used to being short of breath or that tired, they don't catch it. So even just listening to patients and hearing them, you can catch them. Not all the time, sometimes.
yeah.
But like I said, more subtle things are a cough. Usually, not usually, oftentimes I have patients come in and say, Doc, many times I have an upper respiratory infection, some kind of a viral or bacterial infection. And then I just have a lingering cough, dry cough that does not go away,
Yeah.
and that often speaks to a like a bronchial hyperresponsiveness or like an asthma kind of presentation. And even like feeling tired, that's another very subtle sign. So I'll have patients come in and say, Doc, I'm just feeling tired. I don't know, I started with this cough, but now I just feel tired. And the problem is that their lungs are giving out now. They're so tired and tight that they can't breathe, and
Yeah.
fatigue sets in.
The tide, the tide. Yeah. 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 And so, when those patients come in, I guess that this the first thing is how do we, because I think a lot of people would like to know, if they do have asthma, what's in the environment? What are the lifestyle changes, that's available for us to manage asthma? I know you shouldn't smoke, I know that much, but what
Yes.
what are the other treatment options? And that's terrible of me, right? Because quitting smoking is hard. It's hard,
Yes.
right? The first thing is don't start, right? But if you do start
Yes.
and you have asthma, those two things are not compatible.
Not
Um,
correct.
but yeah, but do tell me, what are the, more progressive or, lifestyle
Mhm,
modifications that you kind of have to watch for if you have asthma?
mhm. So, paradoxically, actually, I won't find a lot of asthmatics who are actually smokers because they
They
it
figured
triggers
it
them so
out.
much that they
Yeah, they
just can't
figured that
smoke.
out. They're like, yeah,
They
you can't
figured
do
that out
that.
exactly.
Yeah.
What I do find is family members of smokers who are asthmatics.
Oh, I had not thought
Yeah.
about that.
Yeah.
Yeah.
So
Yeah.
oftentimes they'll be like, Doc, either my husband or my father, whoever, my mom smokes at home, and I have asthma. I don't smoke, but somebody smokes at home, or
Yeah.
even if they don't smoke inside, they come with smoke on their clothes, and that can
Mm-hmm.
set it off. Even
Yeah.
as subtle as smoking outside on a cold
Mm-hmm.
winter's day,
Mm-hmm.
bringing that
Yeah.
smoke in, and that sets off patients' asthma attacks. So
Oh.
that is one. Vaping now has become more popular. That's
Mm.
another set off, whether it's
Yeah.
exposure to it or you smoking yourself. Air pollution, of course, we have wildfires and things like that. That also sets off
Yes.
irritants. Odors, your perfumes, even incense. Incense is very common around these parts. Patients
Interesting.
like, hey, I don't burn candles or anything, but I do burn incense. That can set it off.
Oh, interesting.
Um, just yeah, even we're at work. So if you're say in construction, or if you do home repairs or things, that can set off asthma attacks. So these are some yeah, triggers. Now, there are also other triggers that may not necessarily be like going into the lung, and that can
Mm-hmm.
be, for example, exercise. So there's something called exercise-induced asthma.
It's
So for
asthma.
some
Yes.
patients, that action of where your sympathetic system kicks in, which is when you exercise, it starts creating bronchial constriction, which then can
Mm.
set off an asthma kind of reaction.
Okay. Can we talk about sympathetic system a little bit for
Yes.
the audience? Yes.
Yeah. So it's the system that kicks in basically when there's a bear in front of you. And
Yeah.
so
Yeah.
that
The
it's supposed to
flight
be
or
the
fright.
opposite.
Mm-hmm.
Yes, fight or flight. So it's supposed to be the opposite, where you're supposed to have an increase in your bronchial dilation. Because
Yeah.
you're supposed to have the power to run away from the bear or
Yeah.
to
You need
fight
all the
it.
oxygen. Yeah.
Oxygen, yeah. But it doesn't always do that, especially in asthmatics. So cold
Oh.
air can set it off as well.
Oh.
If you're anxious, or if you're stressed, or even some medications, it's like aspirin, ibuprofen, some beta blocker medications for
Mm-hmm.
heart rate control, blood pressure,
Yeah.
those can set off asthma as well. So
Asthma.
these are some
Yeah.
triggers.
Yeah, that could be problematic if there's a bear in
Mhm.
front of you and you're trying to make a run for it. And well,
Yeah,
maybe here they're not supposed to run from bears, but I always think about lion that you don't want to run from a lion. Yeah,
that's
but yeah,
true.
that's a problem if then instead of
Yeah,
your airways opening, they're kind of closing up on
closing
you.
up.
That
Hmm.
is that's good. That could be a life-threatening situation there. Yeah,
Absolutely.
the best to avoid lions if you have if you have asthma.
Lions, you got it. Or your boss at work, whichever one.
Yes.
Whichever
Some
one
people
sets it
does,
off.
yes. So yeah. Some lionesque. Yeah. Okay. Is it back to work, back to work. Okay. So is asthma progressive? Would you say asthma is a
Mm,
progressive lifelong condition? Do you kind of grow out of it? Let's say you're a
mm,
kid in teenage years. What
mm,
do you think?
mm.
What's been your experience?
So, yes and no. The one thing to understand is usually there's something called the atopic triad, which is it comes in the family. It's called asthma, eczema, and seasonal allergies. They're the
Okay.
atopy. They're
Okay.
three sisters or cousins, you can say, that come hand in hand, and they travel in packs and they travel in families.
Okay.
So the if you have one of these, you're genetically driven to have the others or develop the others, and someone in your family may also have one. So that's something to remember.
Hmm.
Definitely, especially with kids.
Yeah.
Second is usually if asthma develops, specifically asthma, it will develop in childhood. Very
Mm.
rarely will we find a patient who will have a true asthma attack in their adult life. Now, we have seen this with COVID, or certain
Mm.
respiratory infections, but
Yeah.
still, it's not someone like, for example, me, who I don't have neither of these conditions.
Conditions.
I'm not going to wake up one day and have an asthma attack.
Yeah. Okay.
Um, Somebody in my family probably has one of the three things, and
Mm-hmm.
therefore I'm genetically driven to have one or the
Basic.
other, and some kind of an infection will set it off. So, to
Okay.
answer your question, Doc, yes, it can. You can grow out of asthma, but you always have the potential to get an asthma attack, depending on
Mm-hmm.
kind of trigger you're facing.
Yeah.
And it's not necessarily it is quote unquote a lifelong condition, but it's
Yeah.
not like a progressive condition because it will worsen over time. The
Yeah.
symptoms when you have the attack may worsen depending on your trigger and your overall health, but it will not progress where your lungs are not being damaged and they're not going to
Yes.
go damaged, right? It's
Mm-hmm.
reversible, which
Visible.
is the
Yeah.
difference here.
Yeah. Yes. And sounds like a difference between that and COPD, right?
Yes,
Chronic
exactly.
obstructive lung disease.
Disease, yes,
Yeah.
which is truly related more to smoking, some
Yeah.
genetic conditions as well. But in this particular, when it's connected to smoking, for example, it's a it's the damage is done. It's non-reversible, but it will
Mm-hmm.
stop where you stop smoking, or the damage is where the
Okay.
trigger stops. Asthma, on
Okay.
the other hand, it's where your bronchioles or your lung tubes are constricting, meaning they're,
Constricting.
yeah, where they're
Yeah.
becoming smaller, where they
Yeah.
actually should be becoming
Bigger,
larger.
larger.
So surface
Yeah.
area is decreasing.
Yeah. Okay. Okay. Makes sense. And so, we've had a number of patients together, I think, over the years, and I can probably share a story of one that we've seen together. But can you share a story? Oh, can you share a story of someone who's kind of been under your care and had an amazing outcome? Tell us a story. We love
Mhm.
stories.
So actually, it was not really. It was related to asthma, but not quite. And I'm actually very proud of this diagnosis. It was a young man, not I want to say about mid 30s, that came in. He had been to multiple doctors for asthma attacks. So he was in mid
Okay.
30s, never had an asthma attack in his life when he was younger. Was a non-smoker. Started wheezing and going to the ER for shortness of
Mm,
breath. Went to multiple doctors. Was always treated for asthma.
okay.
Felt better initially when he was treated, but the symptoms always came back. And the symptoms he was
Okay.
having was wheezing. He would feel short of breath, especially when he laid down. And these were very frequent. And he would also have a panic attack actually with
Mm,
those.
yeah.
But so first, my suspicion went up because, like I said, a 30-year-old or a 40-year-old will not develop asthma overnight, just randomly, without some kind of a history. And he had nothing.
Yeah.
Second, his presentation was not very typical, where you have asthma that's positional. It's usually not positional.
Yes.
And so what I did was actually I started looking into his throat, or around his throat area. So
Oh,
there is something
okay.
called vocal cord paralysis, or
Wow.
paradoxical vocal cord movement. Sorry, not
Yeah.
paralysis. This is where the vocal cord moves in a way where it mimics asthma and causes that kind
Oh.
of wheezing, but is not related to asthma. So
Hmm.
initially, that was my thought, that he had some kind of a vocal cord issue
God.
here.
Okay.
But then he also started having some neck and back pain. And then I realized that was
Interesting.
probably having some mass effect. So we started
Oh.
looking at his throat, did a CT scan, and we found actually a possible paraganglioma.
Oh,
Um,
wow.
yeah,
Okay.
which
So
was
that's a
causing,
okay.
yeah,
What's a paraganglioma? You're taking
paraganglioma.
us there,
Yeah,
right? What's a
sorry. So
paraganglioma? Mm-hmm.
it's a pretty rare neuroendocrine tumor. So it
Tumor. So
belongs
the
to both
tumor.
the endocrine as well as the neurological
Neurological
system,
tumor. Okay.
usually around the neck area.
Yeah.
And this one had grown pretty large, where it was causing mass effects and was giving him asthma-like
Like
symptoms, but
symptoms.
not causing asthma.
Okay.
Yes.
So the paraganglioma could cause asthma-like symptoms. So
Yeah.
could the voice box,
It
laryngeal nerve
can.
palsy.
Yeah, it
Yeah,
can.
which he
But then
did
again,
not have.
which he did not. But then again, I'm talking about rare symptoms here.
Yeah.
Usually, if it looks like asthma and talks like
Walks
asthma,
like
it
asthma.
is
Yeah, walks like
asthma.
it like asthma. It's probably asthma. But sometimes, patients could kind of, they've done their Google homework,
Mhm,
right? And they think it's asthma, and the
mhm,
doctor is still asking these questions, right? So it's kind of also good for them to kind of say, understand, right? Or
mhm,
somebody that you've never seen or you haven't seen in a few years calls you and says, hey, I think I'm developing asthma. Why don't you just prescribe my inhalers? Are you
mhm,
being difficult? And you're like, no, you have
mhm,
to come in because you're
mhm.
thinking about all these other possibilities
Yes.
that are not necessarily common because, but the person that I already looked at Google, I already made the diagnosis. So it is
Yeah.
important to kind of for people to understand all the what we call differential diagnosis, all the
Mhm.
other possibilities that are running through your mind that you're
Mhm.
trying to rule out, because
Yes.
maybe not everyone with shortness of breath is going to get better with the inhaler. So do
Yes.
think it's I thank you so much for kind of making those points and just kind of walking us through your thought process when you had
Mhm.
this patient who presented
Mhm.
atypically,
Mhm.
but still you're able to get the diagnosis.
Yes.
So I'd say that's one to be proud of, Dr.
Yeah.
Teja. That's one to be proud of. So question. So
Yes.
how can so we talked a little bit about how the doctor can differentiate, right?
Uh-huh.
Or what the doctor is thinking. But how could
Yes.
patients differentiate a little bit between asthma and probably other kinds of or what would you say, because I think they would
Mhm.
like to know, is this my asthma attack or is this
Mhm.
something else?
Mhm. So, if you have had asthma in the past, you probably know what an asthma attack feels and looks like, or even just asthma in general, not necessarily an acute attack. But that being said, asthma is when you feel short of breath, you have the wheezing most likely, and there's something triggering. For example, you walk out in smoke or cold air or exercise or something triggers it, and then usually if it's not very severe it goes back to normal. That's usually what asthma would be like, as compared to something like allergies, for example. That has more to do with histamine, which is a similar spectrum but different effect. And histamine will cause more effects like runny nose.
Yeah,
It will cause itchiness.
itching.
It can cause also actually cough, but understand that that cough can actually point towards more of a asthma allergy overlap syndrome or bronchial
Mm.
hyperresponsiveness. And a side note on that, singular is a very good medication for that.
For that. Yeah. Well, I'm going to have to take you to bronchial hyperresponsiveness. You got me. You can't get
Yes.
away with that, right? So, can you tell us what bronchial hyperresponsiveness is?
Yes. So I'm sorry, I'm throwing big words, but bronchial hyperresponsiveness, essentially what it means, where the tubes of your that go through your lungs are responding inappropriately to something. So
Mm,
for example, you and I, if we are faced with cold air or smoke, we're not automatically going to, maybe a little bit of cough or a tickle in the back of the throat, but we're not going to close up our tubes.
yeah.
That's what asthmatics are doing. They're
Yeah.
closing up their
Yeah.
tubes, which is almost like maybe if you look at it like a protective mechanism for them,
Mm.
but we call that hyper responsiveness, where it's
Responsiveness.
like the response is not in keeping with the stimulus.
Yeah, yeah. So you're over hyper, right? So bronchial is
Mhm.
the tube, it's hyper responsive. So you couldn't be responsive, which is normal, but if you're overdoing it, then you're hyper responsive. And in this
Correct.
case, the tubes are kind of clamping down and things
Clamping
air
down.
is not passing through and nobody's happy.
Nobody's happy. Yes.
Okay. So I know you have a lot of superpowers, but if you had one superpower, tell us, and that would make a difference in the world. Tell us what it would be and why.
So that actually would segue into my next passion, which is mental health, actually. So
Mm,
my superpower would be more um, if I could pinpoint the emotional trigger for someone for a medical condition, that's something that I would wish to have.
yeah,
I've noticed through practice and through interactions and generally just living that we do have physical symptoms and they're absolutely real, but there's always a mental thought or an emotion that triggers it, some kind of a event. And that then has a cascading effect. So, somewhere, if I can identify that trigger, I think that is the real healing point,
yeah,
not the stuff that we heal physically, like here's a pill, here's this,
yeah.
what is that original thought that started this cascade? I wish I had that superpower.
That is an amazing film. That is so deep. What is the original thought? Isn't that something? Wow. So I am going to actually go back here because you didn't quite give us kind of a full gist of who you are? Because I can tell, and I love the way you've kind of just explained this very
Mhm.
thoughtfully, but it also shows your passion and your commitment. So I'm going to go back and just tell everybody a little bit about Dr. Mehendale because she is so modest. Okay, so she graduated from Windsor University. That's who you were just listening to. Trained at Oakland Physicians Medical Center Family Medicine Residency in Michigan, and is one of our top doctors in the Bellevue, Greater Seattle area. And you've been practicing medicine for how long now?
In the Seattle area for about over 2 years now.
Okay, okay,
Mhm.
okay. Well, good. So, and then, so how can people find you?
Internet's a good place to start.
Yes.
I think they can definitely. I think we have access through Bookadoc. I think is our new platform that
Okay.
we're taking appointments now, and ZocDoc is also a place. And then
Okay.
of course just calling medical arts, and
Yeah.
then my colleagues are all over. And if you need a primary care referral, we're happy to help. We're a private group practicing in on 116th, and we have other doctors as well who are really passionate about medicine. So we all love to do primary care and see patients.
We love your team and love you and thank you so much for everything that you do for our patients. So it's Medical Arts Associates and they're on 116th Avenue in Bellevue, Washington. And then we're gonna have the information on the show notes. So if you need to see a primary care doctor, now you know where to go. Well, thank you so much, Dr. Mehendale. Really appreciate your thoughtful insights. I know I needed a refresher course on asthma. So thank you so very much. I appreciate you coming in.
No problem. Thank you, Dr. Dada, for this invite. I feel honored, and this is a great platform, and this is something wonderful that you're doing. So thank you for doing that as well.
Okay. Bye, everybody.